Now we're going to talk about hyperthyroidism. And if you recall from the A&P lecture on the endocrine system, the thyroid is in charge of metabolism. So if somebody has hyperthyroidism, that means metabolism is at all-time high, right? So they have increased metabolism. They have too much T3 and T4 circulating for whatever reason. Now, Graves' disease is one type of hyperthyroidism. In fact, it's the most common type of hypothyroidism. And many people, especially older adults, present with cardiac disorders. Like they'll come to the ED saying, I feel like I have palpitations. Their pulse will be irregularly irregular, okay? And they have AFib most of the time. And this is a cardiac strip of AFib where there's no P waves. They've been replaced with these fib waves. And if you can look, just by looking at this rhythm, you can see that it's irregular. Okay, signs and symptoms that you're going to see in adults with hyperthyroidism, you can remember from the mnemonic sweating. And they are going to be sweating, okay? Remember, their metabolism is way high, okay? W, weight loss. Despite an increased appetite, they're going to lose weight. E is emotional lability, meaning their emotions are all over the place. Very anxious. Exophthalmos, look at this picture. It refers to bulging eyes, and that happens in a type of thyroidism that is called Graves' disease. That's an autoimmune disease, and that's the most common type of hyperthyroidism. A is also for amenorrhea. T is for tremor. Okay, remember, everything's up. T is also for tachycardia. I is for intolerance of heat. Now, let me explain this to you because students get confused because they have lost weight, they are thin, they have little baby hairs all over their body, right, trying to keep them warm. But remember, this is a condition of hypermetabolism. So their bodies are almost like, fire pits, fire burning. So they feel intolerant of heat, like they can't stand to be in the heat. They can also have insomnia, one of the first signs they show up with. N is for nervousness and tremors, and G is for GI problems such as diarrhea. Now, anybody with thyroid problems is going to be at risk for something called thyroid storm, which can kill them. So, anytime somebody with a thyroid disorder, hyperthyroidism, has an increase in their temperature by 1 degree Fahrenheit, that may indicate impending thyroid storm. You want to get them in a quiet room. You want to turn out the lights, reduce all that environmental stimuli. If there's too many people in the room, get them out of the room before you call the provider, okay? Older adults may present with the heart conditions. They may also be depressed and have apathy. They may have lost weight and they may be fatigued instead of feeling like, up all the time. They may feel like fatigued, okay? And they can have those heart problems like shortness of breath and palpitations. Okay, for primary hyperthyroidism, they're going to have a low TSH, so low pituitary hormone, right? But they're going to have high T3 and T4s. For the purposes of practical nursing, you're only going to be tested on primary problems. In other words, it's the thyroid that's having a problem. There are secondary and tertiary problems. Like a secondary problem would be like somebody had a hypophysaectomy, they had their pituitary removed, they can no longer secrete TSH. You're going to be tested mostly on just basic hyperthyroidism, okay? So those are the labs you want to look at. The EKG, that can be done to determine if they're having any type of dysrhythmias or tachycardia. A resting heart rate greater than 80 beats per minute while sleeping. So most of you, if you have like a wearable, you can monitor your heart rate during sleep, see if it's greater than 80. That could indicate you have hyperthyroidism. And a thyroid scan. So nursing implications for a thyroid scan. You cannot, it should not be done on pregnant people. All right. Medication, check a medication history. You want to make sure, or you want to know if they're taking iodine medication. And you want to see if they've had other diagnostic tests with iodine recently, and then you would notify the provider of these things. Thyroid scan is done. Anytime you hear the word scan, that's a test that they're going to be injected with isotopes, and they go to nuclear medicine to have that done. When it comes to interprofessional collaboration, you would be collaborating with a radiologist about a thyroid scan, endocrinologist about medications, pharmacists as well about medications, and a dietitian because they're going to need increased calories and you want to make sure that they're healthy calories, right? So you're going to work with a dietitian. So the nursing implications, if you have somebody in the hospital with hyperthyroidism, you want to keep them calm and let them rest, okay? You might have to administer sedatives if they're really, up. And you want to keep the room cool and quiet. If they develop a fever greater than 1 degrees Fahrenheit, you need to make sure you get environmental stimuli down, call the provider for orders, okay? You want to do daily weights and INO. They're going to need a high calorie diet. They should not drink caffeine or take any other kinds of stimulants. You're going to give the anti-thyroid medication and a beta blocker. They may be put on a beta blocker to decrease their heart rate and so that the heart doesn't have to work so hard. You want it to monitor temp and vital signs because when people with hyperthyroidism have stress, any kind of stress, it could be a nursing student going through, final exams. It could be trauma, like they get in a car accident or they fell down a flight of stairs. I don't know, I'm making it up, but it can be any kind of stress on the body. They can go in to thyroid storm. It doesn't have to be just with removal of the thyroid gland. There's a lot of different scenarios somebody can have thyroid storm. So you have to recognize it, and one of the first signs is that temperature and tachycardia. Okay, so medical management includes radioactive iodine therapy with I-131. This is also called ablation therapy. So they can have that done, or they can have a thyroidectomy. So with the radioactive iodine therapy, you have to teach them to stay 1 meter from pregnant women and children right after they have it. They're going to have to drink a lot of fluids, and they may need to take a laxative to get the stool out that's radioactive, okay? You're going to look for signs and symptoms of radioactive iodine therapy. So hematemesis, epistaxis, and nausea and vomiting. In other words, mucous membranes are irritated. They can also monitor for iodism. That means too much iodine. So metallic taste in the mouth, stomatitis. Again, there's that inflammation of the mucous membranes and severe nausea and vomiting. Before thyroid surgery, somebody may be given iodine solutions to kind of shrink the thyroid gland, which the thyroid gland is in the throat, butterfly-shaped organ. So before they would shrink it so the surgeon has an easier time trying to take that thyroid gland out. Post-op care after a thyroidectomy, they're being operated on their neck, right? So the neck may swell after. So you have to be very cautious and really assess that airway, assess respirations, make sure air is going through. Because if you hear stridor, that is an emergency situation, okay? That could be due to swelling, or it could be also due to a low calcium. If you recall in the A&P lecture, the parathyroids are on the back of the thyroid gland, and they're teeny tiny, and it's very easy for the surgeon to inadvertently remove the parathyroids, okay, and that's what they can get a low calcium from, okay. You want to make sure you place the patient in semi-Fowler's or high Fowler's position. You want to support the head. Do not let them extend the neck. Keep the head and neck in a neutral position. You're going to monitor the front and back of the dressing for bleeding and hematoma formations. If your patient says to you, my dressing feels tight or I feel wetness at the back of my neck, It could mean they're bleeding. They could get really restless too. Provide pain relief. You want to assess the patient's voice, but discourage them for talking. So, because the reason is, it's that area that the surgeon operates on is near the laryngeal nerve, so they could get laryngeal nerve damage, and you expect that. You expect them to be hoarse for a few days. So you would tell them, we expect you to be hoarse for a few days, but you still want to check it every 2 hours. So when my patients would come to the PACU to me, the first thing I would do when they wake up, I'd say, tell me your name, because I wanted to hear their voice. And then the second thing I would do is I would tap their face to see if they have Chvostek sign, because I'm monitoring for hypocalcemia. You want to also keep trach at bedside, and you want working suction. That is my pet peeve when I go into a room and the suction is not set up, but everything's there. You don't want to be in an emergent situation trying to put that together, because your hands are going to be shaking if your patient's not breathing and you need the suction and it's not put together. So always make sure it's working. That's the first thing I did when I worked in PACU. I would go to the suction, I would turn it on, I would put my finger over the end of the tube to make sure it was working. Okay, now you also expect the dressing to have a moderate amount of serosanguinous fluid. So that's expected as well post-surgery. Postoperative bleeding. Okay, this could be for any patient. They're going to have restlessness if they're bleeding. They're going to have tachycardia, because when your body is under stress, it needs more oxygen. Your heart starts pumping faster. Okay. The dressing, they complain of a tight dressing, or they complain of wetness on the back of their neck. You're going to have to look for bleeding. Also assess for hypocalcemia, or remember the mnemonic CATS. So check for convulsions, means seizures, right? They're going to be at risk of that, low calcium. Chvostek sign. And if you look at the diagram here, A refers to Chvostek sign. You tap the facial nerve, which is right before the ear. And if the lips turn up, okay, that means they have low calcium. You're going to look at the monitor strips for dysrhythmias. They could have tetany, tingling around the mouth, so that's called circumoral perianesthesia, or it could be oral numbness and tingling. They may describe it like that. Trousseau sign stands for carpal pedal spasms, okay? So how this is done, if you look at picture B here, you're going to inflate the BP cuff up higher than the systolic blood pressure, and you keep it inflated for 3 minutes. I know that makes me nervous, but if they have a carpal pedal spasm, like in this picture B, that means they have a positive Trousseau sign. That means they could have hypocalcemia. And then, of course, hypercalcemia can also cause muscle spasms and stridor. So you're going to be monitoring for that. Nursing implications of hypoglycemia post thyroidectomy. So you're going to assess for Chvostek's and Trousseau sign, also the other signs I mentioned on the previous slide. You always want to make sure you have a patent IV to administer calcium, because you don't want to have to insert an IV in an emergency situation. Make sure you keep an intubation equipment nearby. When they go to their room from the PACU, they're going to need a trach tray in the room. Maintain a quiet room and keep patient movement at minimum. Okay, people with hyperthyroidism are going to be at risk for thyroid storm. And some of the risk factors include surgery, trauma, infection, like look for UTIs, emotional stress, pregnancy, okay? Any tests with contrast medium containing iodine can trigger a thyroid storm in people with hyperthyroidism. Aspirin products, okay? So you never give aspirin for a fever. You're going to give acetaminophen, because it could cause thyroid storm. And you look for somebody that has hyperthyroidism to have a temperature greater than 1 degree Fahrenheit may indicate impending thyroid storm. So if that happens, you have somebody with a temperature like that, you want to reduce environmental stimuli, turn off the lights in the room, get everybody out of the room, make them quiet, and call the provider. Okay, now recognizing cues of thyroid storm. So they're going to have a high temp. It can go like as high as 105, so that's 40 degrees Celsius. I mean, that's really high, right? High heart rate, usually greater than 200 beats per minute, and they're going to tell you they feel like their heart is racing out of their chest. High blood pressure, so everything's high, right? High respiratory rate. High, and they might complain of chest pain, they might complain of coma and death. They're going to be very anxious and irritable. So you want to reduce the stimuli, right? You give them acetaminophen. They're probably going to have to go to the ICU and get cardiac meds IV. They'll need sedatives and definitely be transferred to the ICU. Okay, let's switch gears and talk about hypothyroidism. So if the thyroid gland is in charge of metabolism, then people with hypothyroidism are going to have low metabolism, all right? So the thyroid is going to be underactive. The autoimmune form of this is called Hashimoto's. They're going to have a high TSH. Remember, I'm talking about primary conditions, low T3 and low T4. They could be iodine deficient. It could be due to surgery, like somebody had a thyroidectomy. It could be due to radiation therapy, like somebody had I-131 therapy, and now their thyroid's not working properly, so now they have hypothyroidism. It could be to medications such as amiodarone and lithium. So those are some of the causes and kind of an overview of hypothyroidism. Okay, to understand the signs and symptoms of hypothyroidism, we can use the mnemonic MOMS, so tired. And it's fitting because people with hypothyroidism have incredible lethargy. Okay, so M is for memory loss. They can be confused, they can be apathetic. So it does affect their brain, and they could have myxedema coma. That's what you're worried about, them getting myxedema coma because they get loss of consciousness. And I'm going to go into more detail about myxedema coma later. O is obesity despite being anorexic. Remember, anorexia is a medical term meaning no appetite. Anorexia nervosa is people who willingly starve themselves, because that usually confuses students. M is for malar flush or menorrhagia. Metabolism is slow. Okay, malar flush means their cheeks get red. Okay, S is slowness, mentally and physically. Slow heart rate, so they have bradycardia. Slow bowel, so they have constipation. Slow thought and speech. Okay, skin and hair are going to be dry, um, really dry. Okay, O is onset gradual, it kind of creeps up on them. T is for tiredness, lethargy, and thinning of the eyebrows. There's a term called the Queen Anne eyebrow, and it means like the lateral third of the eyebrow is gone. So like when I'm looking at people and I notice that the last third of their eyebrow is gone, I'm thinking, I wonder if they have hypothyroidism. I is for intolerance to cold. Okay, now remember, even though they're overweight, okay, they're still going to have intolerance to cold because their metabolism is low. They could have irritability. Um, they could have, R is for really low blood pressure, which is, would concern me. E is for energy levels fall, so again, lethargy. D is for depression and delayed relaxation of reflexes. Nursing interventions for hypothyroidism include promoting rest by spacing activities, so teach them how to manage their activities and alternate rest periods with active periods. Protect against the cold, so maintain the proper temperature in the room. Monitor the temperature because they can get hypothermic. increase fluids to help promote, or alleviate constipation. Orient them PRN because they could get confused. No electric blankets or heating pads because it can cause burns. Monitor for edema. Avoid fiber, laxatives, which you would probably think you would want to give, right? For the constipation, but you can't. Calcium and iron because they decrease levothyroxine absorption. Lots of questions on ATI about levothyroxine. So make sure you're administering that each morning before breakfast. It needs to be given on an empty stomach, and monitor for signs and symptoms of hyperthyroidism, meaning the levothyroxine has overcorrected their hypothyroidism. Mixed edema coma is severe hypothyroidism. Could occur due to infection. It could occur because they were given certain medications like opioids, barbiturates, tranquilizers. It could occur due to trauma or exposure to cold. So in other words, stress. All right, signs and symptoms of mixed edema coma. You have to watch out for these. Be very concerning if they have hypothermia, hypoventilation, so decreased breathing, hypotension, low blood sugar, bradycardia, and unresponsiveness. Those are the signs of mixed edema coma. When your patient is in mixed edema coma, you want to make sure you maintain a patent airway. Start aspiration precautions. Don't use electric heat to warm them up. Investigate if the patient's had an infection recently. And then you want to make sure you're doing daily weights and eyes and nose. Here's a comparison chart so you can compare hypothyroidism with hypothyroidism. Students often get confused with the signs and symptoms with both. But if you can remember that hyperthyroidism is increased metabolism and hypothyroidism is decreased metabolism, that will help you immensely. So read through this and do a brain dump about on a comparison table to see how you do before taking the exam, and do lots of questions in ATI about hyper and hypothyroidism because there's going to be a lot of questions on your predictor about this thyroid conditions. Okay, hyperparathyroidism. They're going to present with high calcium and low phosphorus levels. Remember that PTH, or parathyroid hormone, increases calcium levels, makes calcium levels high. So calcium and phosphorus live in an inverse relationship. So if calcium is high, phosphorus will be low. Signs of hypercalcemia. Remember the sayings: bones, stones, groans, thrones, and psychiatric overtones. So calcium is like a sedative to the body. Okay, so the bones are going to be brittle. They could get kidney stones. They could have constipation because the bowel slows down. So they could get an ileus, right? Because it's like a sedative to the body. They could get abdominal cramping. They could get increased urinary output. That's the only thing that increases, but they spend a lot of time on the throne. And psychiatric overtones, meaning they have depression, apathy, and lethargy. People with hypoparathyroidism have low parathyroid hormone, and this is going to result in low calcium and high phosphorus. And just remember your cats for signs and symptoms of low calcium or hypocalcemia, which we've already talked about.